Happy Valentine's Day, everybody. How are you? Good to see you. First, please let us thank our sponsors, Steadfast in the back. I don't know if we've ever had Starbucks coffee here. That's pretty fancy. Coffee and thank you so much, Steadfast. And in the lobby, we had the DA's office and Kevin. We had the Registry of Deeds, City of Worcester, if you need any information there. We have a blood pressure clinic with Pivot Health. So thank you to all our sponsors. And Amanda's going to be doing massage therapy in March. And WPI is here as well as Blue Cross Blue Shield. So if you need any other information, step out into the lobby. But don't do that until you listen to this amazing program today. So our Distinguished Speaker Series continues. I am thrilled to welcome Kelly Hamilton, a registered nurse at UMass and a holistic nutritional coach. She is with A Better Path to Wellness. Her information is also in the back. Her husband's in the back with another sponsor table, so get information from them as well as Phil George, a biochemist and a health coach, and he is the host of Wellness Wave Radio, and they're here to present a Heart Month seminar. Welcome.
Hi, everybody. Thank you guys so much for coming out and spending your Friday the 13th, but don't worry, we're not superstitious. Everything's going to be fine. We're going to talk about heart health this morning. We're going to have a great time. Just so you guys are aware, there are some hard copies of a resource handout on the tables. I tried to put like 2 to 3 on every table. Try to give it to someone at your table who doesn't have access to either computer or email. On the table in the back where my husband in blue is, there's a digital. You can either take a photo of that or the QR code, and you can have it at digital access, instant access, okay? And if for some reason you don't get a hard copy and you need one, please let Suki know or us, and we'll get you a hard copy of that, because we really want you guys to be able to take home some of this really wonderful, valuable information that we're going to go over today.
Okay, ready to go. So this kind of self-explanatory right here. In terms of, it's really, you can take all the medicine you want in the world, but it really, unless your diet is dialed in, you really have some serious problems. Kelly, why don't you introduce yourself?
Yeah, so Suki, thank you so much for the introduction. My name is Kelly Hamilton. I am the proud owner of A Better Path to Wellness. We're an evidence-based holistic nutrition coaching company based here in Worcester, but I work with clients really all over New England. I do group workshops, corporate wellness events with Phil, and I also do one-on-one coaching for people who are suffering from chronic illness and disease. I am bridging the gap in your care plan. So to have a nurse, nutritionist, and health coach all in one functioning to benefit you and your health is more than you could say for anybody else. So if I offer free consults, Phil and I tag team our one-on-one clients together, so you get 2 for the price of 1. My husband, again, is in the back, Mr. A Better Path to Wellness, as he's called on days where he helps us today. And we love traveling, and we are very into sports and fitness hobbies.
Okay.
Use your mic.
Oh. So I'm so used to being on TV and radio, and the microphone's right in front of me. So
I have to get the boomstick. Yes.
So usually I talk loud enough. I don't need a microphone. So anyway, so I'll have to get used to this. Also, I have a TV show in Leicester. Again, Wellness Wave Radio. What I do basically is, with most doctors, they give you a pill or they give you something else. As a biochemist, I want to know what the root cause of the problem is. In other words, I don't want to just give you a pill. I want to find out what the actual problem is. So I like to call it, Kelly and I kind of like medical detectives. We want to find out what's causing the problem as opposed to just giving you a pill. I'm on Leicester Cable also. If you type in Wellness Wave Radio on any of your browsers, I'll pop up because I'm also on YouTube. This is a big disclaimer. This information is for informational purposes only, should not be taken as medical advice. When I meet with a client, what I do is I say, if I were you, this is what I would do, but I'm not you, okay? You have different genes than I do, you're on different medications than I am, so it's general advice. But again, if you're seeing a doctor or a medical professional, you wanna speak with them. Okay. So one of the things that happens, Kelly and I have been doing a lot of seminars together, and we do like feedback. In other words, what could we do better? And one of the criticisms, would you say?
Yeah, constructive feedback. The constructive feedback we got.
Is sometimes I'm a biochemist, sometimes I lose my mind, I get a little too technical, and I use too many fancy words.
He makes my head spin sometimes.
So what I do is, every time I get out of line, use a fancy word, Kelly's going to throw a ball at me, okay, to try to keep me in line. So we run these entirely differently than most seminars you've been to. We run it, if you guys remember, Trivial Pursuit, that game? So this is going to be run like Trivial Pursuit. And what's happened is also, it's different times of game shows. And we have Suki. Suki is going to identify as Vanna White. Okay, so I told her to put a fancy gown on, but she didn't have one. So one of the things we're going to do is we're going to ask questions, and whoever raises their hands first is going to win a gold coin. Okay, and Suki's going to figure out. We're going to put Kelly on the spot. Kelly's going to determine whose hand goes up first. You know what, Kelly? If we have a tie, we'll give out 2 coins. Whoever wins the most coins, the top 3 people that win the most coins are going to win a $25 gift card to New Chicken. Now, New Chicken is a brand new restaurant in Worcester, and I'll get into that. You like New Chicken? Now's your chance, so make sure you raise your hand. Okay, one thing about New Chicken, I'm going to cover this real quickly, is you guys probably heard you're not supposed to eat fried food, right? Most people have heard of that. Well, one of the issues, not so much with the fried food, it's the oil it's fried in. You guys heard of canola oil? Oh, I like that. I like that. So most chicken restaurants, they fry everything in canola oil, and it's very oxidative. All that means is basically, absolutely right. They cook theirs in avocado oil. Monounsaturated, like olive oil, very heart healthy. This whole presentation is on heart health. So it's what you eat is what you become. So you get a chance to win some gift cards. Okay, the stuff you're going to hear now you haven't heard anywhere else. This is basically going to be medical heresy for a lot of stuff you've heard before. I'm a biochemist, okay? I want to know the mechanism of action, why things happen. Most doctors, what they'll do, Western doctors, they're going to give you a pill or a procedure. So I want to find out what's causing the problem. There's an expression in science that medicine advances one funeral at a time. Somebody has to die for things to go forward, because people are so invested. If you wrote a book and everything is based on one particular theory and they prove that theory wrong, you're not going to like that. So you're going to want to stick to that. So this is going to be stuff you probably haven't heard before. And again, I've got tons of studies that can back this up. So if you have any questions, feel free to email me, philgeorge@charter.net. This is basically, it's 10 to 20 years before the newest science catches up with Western medicine. It takes a long time. There's a lot of stuff out there right now that most doctors they didn't learn in medical school. So this is new stuff, new information you probably haven't heard before. Okay, we talked a little bit, it's called allopathic, don't throw that ball at me. It's called allopathic medicine, which is Western medicine. It's what they call reductionism.
Yes.
In other words, they look at one thing. So if you've got one problem, you're going to see a gastroenterologist, they're going to deal with that, but they're not looking at the big picture. So we look at the big picture. It's called holistic medicine. Diagnose and adios, you know. Right now, what happens is I have tons of physicians on my show. I have just about every medical professional you can imagine on my show. And what they tell me, they got between 12 and 15 minutes to see you. You come in, what's your problem? Here's a pill. Here's a procedure. Okay? They tell me that. I've had 2 doctors I know personally. I know Kelly knows one of them. They've left Western medicine and they went to private practice, and they're going to deal with you one-on-one. Art Parquette, the manager of my TV show, he asked me for a doctor for his son, and what they found out was they went in, they saw this doctor. This doctor sat down with them for an hour and a half on the first visit, an hour and a half. Because if you come in, they're going to ask you, what are you eating? Are you stressed? Is your husband stressing you out? That kind of stuff, And again, we don't want to look at pills. We want to basically find a process. Okay, you ready, guys? Your arms warmed up, ready to jump up? Okay, what's the definition of insanity?
This gentleman right here in the back in the brown, he was the first one.
Yes, sir. That's correct.
We have a winner, Vanna White.
Where's
Give
Vanna?
that man a coin. Suki, the gentleman back here in the tan jacket. Thank you.
Okay, you ready for part 2? This is a harder one. Oh, by the way, we have some repeat participants here. And so if you've heard this before, please, if you already know the answer, please don't chime in. There we go. Exactly what you said. Who said it?
That was a great guess. Not the right guess, though.
Right
yes.
here? Albert Einstein.
Albert Einstein. We're going to get this woman up here in the front in the green a coin as well. And how this relates to healthcare, guys, is basically, and your diet and lifestyle is unless something changes, nothing's going to change, right? And that's what we're here. That's what Phil and I pride ourselves on. We meet you where you're at, and we help you make some positive, sustainable, affordable changes in your health so that we can reverse some of these disease processes that we're going to talk about.
Okay. Where does the U.S. rank in Western countries in terms of healthcare? First, second, third. Any guesses? Who said way far down? Okay, it's lapped actually. You go one. And where does it rank in terms of cost of healthcare?
Highest, yes.
Okay.
We'll give these two, this gentleman in the salmon jacket and this woman in the red, a coin here.
So guys, we're paying the most for the worst. We're paying the most for the worst. And if you looked at your Medicare, I just got an increase in Social Security. Most of that was eaten up by Medicare cost. But if I need to see a doctor, how long is it going to take me?
Yes.
Months to get an appointment. So you're paying a ton of money for something you may not even be able to use. What percentage of Americans are metabolically unhealthy?
Yes. 80%.
Who said 90?
Yeah, I'd say
93.
93. Second coin for my friend over here in the front.
And
Wonderful.
she's in first place.
She wants new kitchen bad. You guys, she's the one to beat.
Metabolism means you got high blood pressure, you're overweight, all kinds of stuff. It's more than just one thing. It could be type 2 diabetes. Okay, this is what we're here to talk about, arterial sclerosis. This should have been a question. This is the #1 killer in the country, arterial sclerosis. It has been for years and years. Okay, what do you think is the conventional cause of what causes heart disease?
This woman in the back.
Actually, I'll take that, yeah.
We'll give you a coin back there in the black sweater.
The question, actually, that'll count because a lot of people think about LDL as cholesterol, which actually does not. But you knew that. Good for you.
So
Okay.
we're gonna bust that myth today. So a lot of people think it's good and bad. We're gonna talk about that.
But you guys are.
Yes.
Exactly right. You want to care.
I love it though. I love that some of you guys know this. That's warms my heart as a nurse that some people are, getting this information.
77% of people that wind up in the ER, that wind up seeing Kelly, have got normal LDL. They call LDL is the bad cholesterol. 77% have normal. The other, out of that, and 50% wind up with heart attacks have ideal LDL levels. So when your physician tells you the problem is LDL, that's not the case. It's not LDL. We're going to get on exactly what kind of LDL is the problem. So the analogy I like to use is this. You guys have got a pipe in your house, right? And you turn it on. Everything's fine. And then all of a sudden, it gets more and more clogged up, right? Because of calcification. This is what happens. This is what happens with atherosclerosis. You may not even know it's happening. It's getting clogged up more and more and more. Okay, LDL is not cholesterol. Think about LDL as a boat. What it does is it floats in your blood and it carries the cholesterol to different parts of your body. So it's not actually cholesterol. It's called a lipoprotein. This is what it looks like. So basically, the cholesterol goes in, fat-soluble vitamins, everything goes in there, and it floats through your blood. It goes to different parts of your body, and it drops off the vitamins and the nutrients. So you need LDL. LDL is crucial. In fact, it was interesting. There's a genetic condition that's relatively rare where people are born with no LDL. Zero. They die really quickly. You need LDL. So when they're trying to drop your LDL lower and lower, at what point does it get too low? Nature is really smart. Your body is extremely smart. It's not going to put LDL in you if you don't need it. So it's not a toxin. Actually, you need LDL. The real issue is the size of the LDL. You get big LDL particles, you have little LDL particles. And this is what they call the bad cholesterol, the bad LDL. So not all LDL is created equal. Kelly, when they measure LDL, what do they measure?
So you guys have all had like a typical cholesterol panel, right? So what do you get on there? You get your total cholesterol, you get your LDL, which we know in allopathic medicine as the bad cholesterol. We know our HDL, which we call our good cholesterol, right? And then you usually will get what's called a total cholesterol HDL ratio, which is where they divide the two, and they give you a cardiac marker based on your cardiac disease score, which we like to see in Western medicine. We like to see that under 5. In functional and holistic medicine, we like to see that number lower than 3, ideally. And then you also get a non-HDL. Now, I think you have you have that later. Phil's going to talk about a way that you can go home and pull up your cholesterol panel, and we can actually look at it a little bit deeper and evolve your cardiac risk.
Okay, I stuck one under you, Kelly.
You did.
And the answer is? Right, that's kind of a trick question. Another guy here.
But my point is that we look at it very segmented, okay? What you usually can get covered under your insurance, or you can ask your cardiologist or your primary care physician to do, is to look at the size of the particles that Phil is talking about. I often talk about it with my clients. I call it being pad threatened. What happens? You go into the office and they say, your total cholesterol is 215, 230. We really want to see that under 200. And they start waving the prescription pad around and say, it's time for a statin medication. And again, statin medications do come with risks. Meds have risks. I'm not saying there's not a place and a time for those. If you've had a major cardiac event, you've had a stent, you've had a stroke recently, or your cholesterol is over 400, you definitely need to go on a statin and then do some back work. But in the meantime, you can ask to be tested for the size to see if you have big, fluffy LDL particles, which mean you're at relatively low risk despite your numbers being elevated, or it'll tell you if you have these small, sticky LDL particles, and that is something we have to take seriously and then start to actively work on.
Kelly, we have some cute slides for this.
Yes,
we
we
got some
do.
cute slides for this. Okay, so a bowling ball could weigh a pound and BBs could weigh a pound. Okay, so they're the same weight, right?
Which one would you rather fall on your head? Right.
So because they weigh the same, when they measure your LDL, they measure called LDL-C, which is all your LDL. Some of those LDLs are little BBs that are not going to hurt you, and some of them are as a big bowling balls that are going to hurt you. Again, we kind of mentioned this. Obviously, you're better off being hit on the head with the BBs. This is Kelly's referring to. So there's two types. A lot of times if you see a lipidologist, which is basically just a person that specializes in lipids, or a cardiologist, they're going to say you have pattern A or you have pattern B. Easy to remember pattern B because B is bad. B stands for bad. So what happens is these little evil-looking pattern B over here and the big fluffy one. So you want to have the big fluffy ones. So you could have the same identical measure of LDL, and again, it's going to be entirely different outcome.
I think that's the next one, right? Or, yeah, it's coming up. Different. That slide still in here?
Yeah. So, okay, it's a fancy word here. The glycocalyx. Okay.
Now you have to explain it in layman's terms.
You guys who know frying pans, remember Teflon? So what happened with Teflon when you cook something? Slid right off, right? You guys you're supposed to use a plastic thing for the Teflon, right? Now what happens if your husband uses a metal scraper? What happens? Then what happens when you cook the egg then? Sticks right to it. Okay. So what happens?
And then you eat it.
What happens is your normal blood vessels, they have it's called the endothelial cells, and that's like the frying pan. It's like the endothelial cells, and on top of that is something called the endothelial cells.
Stretching, I wasn't gonna.
And on top of that, I'm sorry, it's called the glycocalyx. That's the Teflon. That's the Teflon that protects it. Again, we talked before, you could have the same amount of LDL particles, but have an entirely different risk factor. Is 125, right, Kelly, about the magic number? You come in with an LDL of 125, they're going to say, I'm going to put you on a statin right now. I'm going to put you on a statin, get 125. These four people here have entirely different outcomes. Jerry, where's Jerry? Is Jerry here? Jerry's fine, because he's got these big, fluffy LDL particles. But Maria, hope there's no Maria here. Maria has got the little LDL, and she's getting very, very high risk. So you could have the same exact amount of LDL particles and have an entirely different risk profile. We talked about the HDL, LDL. Again, it's incorrectly referred to as bad cholesterol. It's what they call oxidized. That's not that fancy.
If you explain it, I won't throw it.
It's coming next.
Okay.
No, Jerry's not here. Okay. So what happens is, you guys ever get rust in your cars? Okay. It's called oxidation. What oxidation means, it means loss of electrons. It's losing electrons out of the paint. The same thing happens with you, with your blood vessels. You're losing part of those blood vessels. It's called oxidation. We talked before about the ApoB. So again, you want to know what your ApoB is. This is the one that really dictates your risk of coronary artery disease.
This is what you would advocate for at your primary care office. I just want to make this clear. Those of you guys that have handouts in front of you, it's on there. So you can take that with you and say, I attended a seminar, or I'm working with a nutritionist, or I had a health coach tell me that this is something that we should have a conversation about. So I do encourage you guys to do that, and the next time you have an appointment, ask if you have high cholesterol or you are on a statin, to have them run this test. It is generally covered by insurance. People just don't know to ask for it, okay? It's a ApoB.
ApoB.
Is the Yep.
Or just ask for a complete lipid profile. It's done by Quest, by all the big lab companies. But again, the vast majority of physicians.
Yes, honey. So this does not come on a traditional cholesterol panel. You have to ask either for the complete profile, which I have clients that have a mixed response to that. If you're looking for just one test and you have a provider that maybe you don't have a great relationship with and you're just trying to get one test to buy you some time to see what your risk factor is, I would just ask for the APOB directly, and you might have a better chance to get that covered under your insurance instead of a whole big extra lipid profile.
And again, you don't have to remember all this stuff. My card's on everybody's desk, and also in the back we have a booth. You can email me, and we'll be able to get you the information.
That's a great question. And hopefully within the next 10 years, I have had a few clients who I have seen it on their lab work without us having to ask for it, which makes me hopeful, but unfortunately it's not part of the standard yet. But if enough people start advocating and asking, we could make it become that way.
But remember, the other slide, it takes 10 to 20 years before they catch up on this stuff. But this isn't my opinion. This is by the National Lipid Association. These are lipidologists. They specialize in lipids. Okay, here's basically the poor man's way of doing it. What they have on almost every single test is called the triglyceride to HDL ratio. If you want to write something down, this is what you want to write down. What you do is you divide the HDL into the triglyceride. Now, HDL is the good one, right? And the triglyceride actually is a bad one. So you divide into it. And what happens is that ratio should be less than 2. This is a poor man's lipid panel. This is extremely accurate. If that number's less than 2, you're in pretty good shape. And if your doctor's pushing you to get on a statin, we're going to get into statins in a minute. You want to say, what my HDL triglyceride ratio is this. And again, I can send you studies on this. You can bring it. When we have clients, a lot of times what we'll do, I'll print up the studies from major journals and show it to your doctor. Because again, doctors are working a ton of hours. I found out we had one friend that's a physician, and she was on my show, and I saw her in her car writing stuff down, and I said, what are you doing? She says, they call it pajama time now for physicians. They go and they work all day in the office. Then they come back at night, and then they have to write notes for the insurance company. So they're working like all the time. And the problem with that is, again, they have no time for themselves. They don't have time to read the latest journals. They don't have time to do that. But I'm crazy. I read the latest journals.
And they don't get reimbursed to go over diet and lifestyle with you. And that is something that needs to change with the insurance-based model. And I have made that my life's mission. So hopefully by the time I'm 6 feet under, insurance companies will have started to change that. Because the whole preface of my business is giving you the evidence-based diet and lifestyle interventions. Because that alone can prevent you from even seeing this. And that's what we really got to focus on, is prevention with our younger generation as well. But treatment, if you already have it, it's not too late with these principles.
Oh, this is for European models right here. I'm sorry, the right side.
This is the US. They do it in deciliters. But yes, this is a comma. Oh, that's supposed to be a decimal, isn't it? Right.
It's supposed to be less than 2. I'll give you a good example. If your triglyceride is 100 and your HDL is 50, that's 2. Yeah, that's good. Yeah, thanks for bringing that up. This is the take home on this whole thing. The problem is not fat. The problem is blood sugar. This drives everything. It drives not only heart disease. It drives mental impairment. It drives everything. The problem is basically too much sugar in the American diet. This is called insulin resistance. Just to be a little bit technical, so the problem is not high blood sugar. It's what they call high insulin. We'll get into that in a second. You're producing too much insulin. Okay, another blood test that they never order. So, hold this for a second. I'm going to do a demonstration here. So, guys can imagine, let's do this. Imagine railroad tracks, right, like this.
So I'll hold it.
Okay.
Yeah. I'm your boom mic. Go ahead.
Like I'm on the radio again. So what happens, this is the way it works. So you wind up secreting blood sugar into your body. What happens, your pancreas, specifically the beta cells, release insulin. And what the insulin does, it opens up a key into your cells and the blood sugar goes in. Okay, you guys with me? Yep. Make sense? What happens is you eat sugar and you're eating ring dings all day long. You're eating potato all day long. You're eating it. What happens is your poor pancreas, it's pushing out that insulin like crazy. What happens, your blood cells, the little opening there that goes in, that gets worn out. So eventually what happens is you're going to pull out more and more. So let's say your blood sugar is 100, and let's say your insulin is 100. These aren't correct numbers. As long as they go steady like this, you're fine. But what happens is, in order to keep your blood sugar down, your insulin has to go up, like, you know that. So your insulin is screaming to you. You're coming down with type 2 diabetes. But you know what? I worked 20 plus years in a hospital lab, and I've never had a doctor ever order fasting insulin, ever. How did you get them to do that? Did you have, yeah, because you had gestational diabetes, so they want that, but you're an unusual case.
We have had clients who have gotten this covered by insurance when they work with us. This is another one you can ask for. And again, the reason is, and if you're picking up on the themes here that we're talking about, is a lot of what we're talking about is there's years where your body has this buffer balance, right? Our bodies are made to counteract some of this damage. The problem is, in the standard American diet, the SAD diet that we follow here in America, we override that mechanism because we hit it too hard with things we shouldn't be having. Because at the turn of the Industrial Revolution, when we realized that we could manufacture fast food, we could Frankenstein put things and take out nutrients in food, that is why we have become so sick and our bodies can't compensate anymore. We have to get back to the basics. And that's why we explain this to you, is that if we can catch it, again, I think it was on either the previous slide, 10 to 15 years ahead of time, just by knowing if this lab is off. A lot of you sitting here wouldn't have a type 2 diagnosis of diabetes on your past medical history if we had gotten you that test 15 years prior and saw that that was elevated.
Yeah, Kelly, it's just like if you smoke one cigarette, you're not gonna come down with cancer. We do it, your body just doesn't come down with cancer or heart disease overnight. It's a long process, so you want to know ahead of time. Yes, ma'am. Insulin. It's called a fasting insulin level. Because remember, the insulin is what keeps. It's what. Oh,
this is a blood draw. That's different. That's a standard snapshot in a moment of time. The other one you guys are probably familiar with is a hemoglobin A1C. Your doctor likes that one because A, insurance covers it, and that was their new, I say 10 years past mainstream media, gold standard because it's very hard to lie to your endocrinologist about the amount of sugar you're eating because they can test that going back 3 months. That's a reflection of your blood sugar 3 months. This is a blood test that is a snapshot in time, but is more accurate of how your pancreas is functioning by delivering the amount of insulin it needs. Fasting insulin level.
It also gives you a pretty good measure of how your pancreas is doing. You're right. So you're talking about a.
So you don't care like how high it can be, or you only care about how low. And the nurse they have nothing to say.
Yeah, that's an insurance issue.
Why don't they change that? They end up, you can't even monitor yourself eating to say I want to correct, and they'll just say, well, you'll never be able to correct it without the drugs, which is a lie.
That's true. You're right.
Yeah.
You're right.
And
So
I hope that we see that change. There's a nurse that I work with who that is her specialty. She tries to help people get affordable glucose monitors out of pocket because We are seeing that in healthcare. That is not lost on your nurses, believe me. I can't speak for the doctors, but it is not right that you have to be giving yourself injectable sub-Q insulin 4 times a day to be qualified for one of the Dexcoms. There are resources out there to help you guys get them if you need them. They're not, and maybe the senior center can figure that out for you and get somebody in here that can get affordable ones, but they're hard to find. But don't give up, because I'm hoping that gets changed.
We have another question. It's called a fasting insulin test. Yeah, like fast, like you're not eating, fasting insulin. No, I think we're talking about the ratio of the triglyceride to the HDL. Okay, good. Okay, actually, that's not on the slide, but I can cover it quickly. So, I'm sorry. Go ahead. Overnight, like a normal fasting, when you do blood work, it's fasting overnight. Yeah, a normal fast. Like you do a fasting blood sugar. You usually do the fasting blood sugar and the fasting insulin at the same time. I don't want to get too technical.
So that depends on your physician. Usually you do an overnight fast and then you get your blood work done in the morning. That's more technical. Yeah, 8 to 12 hours is like the Western medicine standard for fasting labs.
So again, it's very complicated about the whole thing with atherosclerosis. But to answer your question, so with the LDL we mentioned before, there's no bad LDL. All it is, there's different types depending on it's LDL-B or LDL-A. But what HDL does, they call HDL the good cholesterol, and it is the good cholesterol. What it does, it actually goes into your arteries and takes out the cholesterol and brings it back to the liver. That's why they call it the good HDL. And drug companies for years have been trying to make a drug for this, and I can't find one. So that's the reason why you could have high triglycerides, you could have high LDLs, but if your HDL is high, you're golden. I had one woman come to me, and I said, "Now they want to put her on a statin." I looked at her lipids, and I was like, "You're fantastic," you know. So again, you got to look at the big picture. There's what Kelly talked about. Here it is. So basically, you can see the insulin. It's keeping the blood sugar down, and around the 15 point, it goes through the roof. By then, you already have insulin resistance. That's a problem. That's why you want to know what's going on with it. Yes, ma'am. Happy. That's a good way to remember it. Yeah.
Just if nobody heard her, HDL, happy or healthy, that's how a good way to remember it. That's the one you want that's higher. That's what I tell my clients, okay? HDL, higher, and LDL, lousy, low. We like that lower. Obviously, we don't want it too low, but for reasons we just talked about, but that's the one that you want to be ideally under 100.
Get that, just go to homocysteine levels. The homocysteine levels are off. Well, I forgot the number now. That's
12.
what they should be checking first. And then go to the
So you're on to something. She's talking about homocysteine levels, which is a whole nother conversation. So Phil and I do go over that with our one-on-one clients. The problem with that is that's a genetic disposition. So that doesn't apply to everybody, and if you do test positive for, there's 2 different forms of that gene. If you test positive for one form, you do have a higher instance to have cardiac issues, but that's a very small subset of the population. So to do that for everybody doesn't make sense. We recommend that when we think there's something going on and we can't figure out why your levels aren't coming down, why you've maybe been on a statin for a year and it's not working, why your vitamin B12, we advocate for our clients to get that done, is not optimal, but it's not part of a standard for cholesterol testing.
But actually, what you're bringing up, I'd let you know, homocysteine is a precursor to heart disease. Homocysteine is basically a waste product. most people that have elevated homocysteine have something called the MTHFR variant that gets a little off track, but what Kelly's saying, it's a subset of the population. It is related to heart disease, but not related directly to cholesterol or HDL. They almost always do triglycerides on a normal panel.
I agree with you. So a lot of functional medicine physicians will do that.
The reason they do it, there is no drug to lower triglyceride. That's the reason they don't emphasize.
But there's plenty of foods that do, and you have them on your handout in front of you.
That's the reason they don't emphasize. In fact, the reason is there's no drug for it, so they can't do anything about it. Except for diet, but they're not going to talk to you about your diet.
If you came to me and I looked at your lab work, I would care more to have a conversation and educational discussion with you about your elevated triglycerides than I would about your cholesterol, hands down. Because the high triglycerides are what's going to lead to fatty liver, insulin resistance, metabolic syndrome, increased weight gain. I mean, that's what we really need. And again, that's why we talk about, and you might think, well, I came for a heart health talk. They're talking a lot about, metabolic issues. It's all connected, guys. Right? The body is all connected. We have to stop looking, and Phil said it, about these specialty physicians. You see a neurologist, you see an endocrinologist, you see a cardiologist, you see a podiatrist. All these things are separate. We have to look at it like one system to really understand what's going on, okay?
Okay, so we're going to get into glycation. So what happens if you have a piece of bacon, right? It's nice and loose. What happens when you cook it? Okay, it gets hard. What happens if you have a piece of toast and you put it in the toaster? Okay, that's called, don't hit me, that's called glycation. Okay, the way it works biochemically is the sugar binds to the protein and it makes the protein hard. That's glycation, okay? The same thing happens in your body. When you eat a lot of sugar, you're glycating your blood vessels.
Oh, AGEs.
Advanced glycation end products. When it gets really, really bad, a little bit doesn't hurt, but then it gets really crusty. You know, if you're heating the bacon a little bit, it's still a little bit soft, right? But you heat it a lot, it breaks in half. That's advanced glycation end product. It's really messed up. It's really messed up your. So what does it have to do with heart disease? Remember, we talked about the endothelial cells and covering the glycocalyx. It messes up this, and it allows problems.
One thing you guys can do to combat AGEs, if you do a lot of stovetop cooking and you're sauteing meats specifically, or you're grilling meats or broiling meats, make sure you're utilizing that overhead fan. If you guys have microwaves over your stoves, or if you don't, we don't, my husband and I live in an apartment, we don't have ventilation systems. I do crack a window. So you can actually ingest the AGEs that come off that charred meats or like animal products that you're cooking, your eggs, your chicken, your beef, your fish. So make sure that, just to limit the amount of AGEs that you're exposed to externally as well, is utilizing proper ventilation when you're cooking, okay? That's gonna help minimize your risk of those as well.
Again, basically, don't cook yourself from the inside out. Too much of that stuff, obviously, with too much sugar is going to glycate you. Same thing, we talked about the glycation. You're damaging the blood vessels, and then what happens, then the LDL particles get in there. So it's not the LDL particles themselves, it's the damage to your blood vessels that let the LDL particles get inside of there. It's kind of the glycation versus a Teflon. You guys know in terms of Velcro? Sticks to stuff, right? Funny, you're not going to know this. Funny story. Did you know how they invented Velcro? Nobody knows. Okay. What happened was it wasn't a scientist. There was somebody walking through the woods, and those sticky things you get, and the spurs that hooked to them, and then he said, "Geez, I bet you we can make something out of this." Guys ever watch Shark Tank? Yeah. Right. That's what I'm talking about. So somebody just came up with this idea, said, "Geez, that could probably make something like this." That's how they came out with the Velcro. Okay. Macrophages. Okay. What does macro mean? Large. What does phage mean? Phage? No, phage? Okay, phage means eat. Phagocyte. It eats.
Think
So
Pac-Man.
this is a big white cell in your body, and we all have them. This is a big white cell. It goes in your body, and it goes around, and it's munching things up. It munches up bacterial kinds of stuff. I had a slide. I bet to put it in, Kelly. It's called a natural killer cell. This actually is the biochemical term for it. It's called a natural killer cell. It's a type of macrophage. You know what it eats? It eats cancer cells. It goes in there and it looks for cancer cells, and it'll munch up the cancer cells. So you have these macrophages in there, and they're looking basically to munch
Thank you.
things up. Anybody ever had a splinter in their finger? Is there a time when you could not get the splinter out, and it stayed in there? And what happened? Yeah, and eventually it went away, didn't it? It festers, it goes away because you have you know what's happening? That splinter in there, even though you can't get it out, your macrophages are going in there and they're eating it. They're literally eating it. So what happens is, this is what macrophages do. That's their whole job, to go in there and eat these things. Exactly. Now we get into the blood vessels. So what happens is, remember, we got all that clotting in our arteries, right? So our macrophages, they want to do their job. They see, like you say, they're having the whole thing with inflammation. I got to clean this mess up. So they go in there and they're trying to eat the cholesterol and get all the cholesterol out of there to get it out. But some people, they just keep on eating the same junk all the time, and they get more and more inflammation.
Then you turn into
You turn it into a foamy cell, and this is basically called a foam cell. So here's your poor macrophage. He's happy. He's munch, 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 gets too fat, and he dies. He dies inside of your arteries. And this is what causes clotting in your arteries, is the macrophage trying to do its job and to clean it up. You guys know carotid arteries?
Yep.
So you think those are important? You think those are important? Why, what do you think happens if these get clogged up? Brain.
Yep. Stroke, no blood flow. Yep.
Right.
Leads
Stroke,
to cognitive decline.
stroke. Couple true stories. I had I can mention this. You said it's okay to mention the manager for the TV show. He had 90% clotting in his carotid arteries. But you know what? You're not going to know you have that. You have those clots unless they look at it. You can go long time. What happens is you can have something done. This is Dr. Eddie Roos. He was on my show. He's from the vascular care group. He's one of the top vascular surgeons in New England. And he does these type of tests. It's called a carotid ultrasound. I had this done, actually, just for the heck of it. And what they do, you ultrasound for a baby, you know, when they put it, okay, same thing. They just put it on your neck. And they can see how much clot you have in there. What happens, the first sign of a stroke normally is you get a stroke. It's too late. You're not really noticing that you got this clotting in here. So if you want this test done, email me, philgeorge@charter.net. I have an arrangement with Dr. Roos. A lot of times you can get your insurance to pay for it. So what happens, you don't want this to be, you don't want your arteries to be clogged up.
And the operation for women is more dangerous than for men, because men have wider arteries than women. So if it's a woman, like my size, because I have it, they monitor me once a year, and I monitor my diet.
That's great. Yeah, carotectomy. Yeah, we see them. I work in the surgical ICU at UMass, and it's a very invasive procedure that you do not want to have if you can catch this early.
It's called the carotid ultrasound.
Oh, sorry.
Was it done by the vascular care group? Yeah. They do a lot of these. So it's good to know. Remember, we talked on the beginning, you want to stop the stuff before it happens. I had one caller into my show actually called in and said, I had 90% blockage. They found it somewhere else, and then they went in there and cleaned it up, so it saved him from a possible stroke. So you want to know this stuff ahead of time. You don't want to wait until you have a stroke.
So they talk about heart disease, you think that would be a no-brainer that they have us all tested to save billions of dollars?
Again, I don't know the reason.
Like, what's the cost of doing that versus
I think he said probably under $100 to do this test. If you're private paid it, you can probably get it.
I already flipped.
Okay.
Who can tell me? Signs of a stroke. What's the acronym? Face. Oh, you guys are so close. Face. You're close. So it's fast. You guys are close. You're so close. Fast.
Right here.
Suki, we got a coin winner here. Fat. Okay. To double or nothing your coin, what does FAST stand for? Yep. Face, arm. Somebody helped you. T. Yell it. Help her out. Time. We'll give it to you. We'll give it to you. Time, right? So this was a very big national service push, okay? Fast. They want you guys to know this because time is of the essence. That's why time's in there, even though it's not a symptom. We gotta speed through a little of this, Phil. I'm getting cues here, so let's keep it rolling. All right, fast. We talked about it, right? Again, this is the worst case, atherosclerosis. This is like the end game here. Now we're starting to see symptoms. We're starting to see clogging. We're starting to see active decline in things happening to your health that are going to land you an emergency room visit or an ICU trip, okay? Symptoms of a heart attack. Chest pain, arm pain, jaw pain. Women present differently than men. We'll put some coins at this table. Suki, over here, please. Coins over here, right? Just know that, okay? If you are a woman, I cannot advocate for this enough. And I'm going to go over my time and stand on this soapbox and use this because you are the ideal demographic for me to tell this to. If you do not feel like something is correct, go to the emergency room if you think it is cardiac related. As a woman, you will be overlooked. If your arm hurts, if your hand hurts, if you have ear pain, if something doesn't feel right and you think it might be related to a cardiac event and you know in your gut, but it might not present that way, please go get it looked at. I can't tell you how many women that we would have saved if they had listened to their gut instinct. Okay, so if you learn one thing from me today, women, you are more at risk because you do present differently. And a lot of male doctors forget that, okay? So advocate for yourself if that is something that you deal with or that happens. Females usually jaw, some neck tension. It could be a migraine. You could have some gas pain, but doesn't present as gas pain. Some women will get kind of like that under the rib pressure. And again, you might go and they might say, you just have gas. And you know what? It's better to know that you had gas than to know you had a massive MI, okay?
Okay, we're going to get into statins now. How many people here are on a statin? Okay, most people. Okay.
About more than half of you.
The most prescribed drug in the world, right, Kelly?
My statistic, 118 million people in the United States are prescribed a statin. That's every year. That's just every year. One of the most written drugs in the country.
There's something in medicine called standard of care. When you come in with something, they have a playbook. And the playbook, they're going to give this to you. Remember, they get 12 to 15 minutes with you. They don't have time to ask you this stuff. So the statin's almost always to go through. Again, if the only thing you have is a statin to deal with people, you're going to give it to them. Okay, here we go. You guys know mitochondria? Yeah. Powerhouse of the cell, right? We learned that in high school biology. Okay, what happens is there's something called the electron transport chain. And in the in the electron transport chain, this is what produces ATP, right? That gives you the energy, the power, ATP. What happens is the very first part of the electron transport chain, you have something called CoQ10. You guys have heard of CoQ10? Yes. Okay. Okay, people are taking statins. Can you raise your hands again if you're taking statins? Now, has your doctor suggested that you take CoQ10? Oh, whoa.
That's,
Okay.
wow, usually. None of you? Or any? Who, raise your hand if you are taking CoQ10. Oh my God, so two. I'd like that noted because I know you guys are filming this. So out of more than half of you raised your hands that you were on a statin medication. This is knowledge that every primary care physician should have. And only 2 of you are taking one. So I did just get permission. We're going to run a little bit over. This is key. These are concepts you need to write down or get on the handout. So let them have the info
So
about that.
a CoQ10 is the very first part of the electron transport chain. It produces energy. If you don't have energy, you got the people on statins. Do you have any kind of muscle pains and stuff?
Fatigue, muscle pain,
Fatigue.
overwhelming. Why do I feel like garbage every day at 2 p.m.? I don't know why this happened to me.
One thing I say on my radio show, I hope to give you at least one suggestion that will make your life a little better. This is the one suggestion, take away with you. What you want to do is you want to go over there. Again, CoQ10 creates energy. And here is at the very last part, a complex 5 goes on with it. You want, okay, I'm going to go buy a hat. You want ubiquinol, okay? Ubiquinol is a form of CoQ10, but it's more what they call bioavailable. Your body uses it a lot better. I'm not on a statin. I take ubiquinol because it gives me more energy. It helps my mitochondria push out that ATP. Yeah, that's very
why.
common.
She takes a statin, just to recap, because I was asked, and Avastatin, she wanted to know, and she experienced cramping at nighttime, which some of you might also.
Very, I can't guarantee anything, but I can almost guarantee you take this ubiquinol, feel free to email me, okay, because you've got to be careful where you get your supplements from. I have trusted sources. Make sure it's not made in China or Japan or someplace like that. When I did the seminar at the senior center, everybody there was having aches and pains and had no energy. The number one complaint people have when they see a physician is, I got no energy. Guess what? The mitochondria makes your energy, and if you're taking a statin, it's squashing down your energy. So again, I would take the ubiquinol even if you're not on anything, because as we get older, our mitochondria don't work as well. So I would take that anyway. It's a great supplement to take.
You have a question over here.
It'll say on the label.
So I might have put that on here for you guys.
Okay, we got to wrap up, Kelly.
I have a chart for my clients, and depending on what you're taking it for, if it's just preventative for a statin or heart health, or there's other reasons you can take it. Off the top of my head, you have to fact check this. I believe it's 300 milligrams. I don't have. That's just deep in. There's a lot going on in here, so I can't guarantee. But you can look a simple Google, like how much ubiquinol for heart health specifically, and it will tell you. But that's a great question, because that's another thing. You want to make sure the supplement you're getting for the money you're paying is the adequate dose that's actually going to help you, so you're not wasting money, okay?
My question is, will it counteract the statin?
Yes.
So if it counteracts the statin and you're on a statin, what's
Oh no, it doesn't interfere with the lowering of the LDL. All it does is it gives you more energy because it's messed up.
It works synergistically.
No. But it will reduce your muscle aches and pains. It's a different mechanism that it works on. Okay, we're almost out of time. I'm sorry, go ahead. Yeah. By the way, this is biochemistry 101. This is basic biochemistry. This isn't like any weird thing. And the doctors, I'm shocked that they don't give you this, because that's the number one complaint people have. They get the muscle aches and pains. They're all over the place.
So the point I was trying to make is, when they made the statins, they knew all these issues, and they were gonna put the CoQ10 back in, but because of the cost.
Yeah, that's right.
They didn't.
Yes.
They screwed everybody.
Yeah,
Yeah.
What she just said is, in the beginning, that we're going to add the CoQ10 in, because this is biochemistry 101, but because of the cost, they decided not to do it.
Yeah, sick care is health care. Okay, guys, I just want to wrap up. I want to be respectful of your time. I know we started late, and you guys have quite a lineup and agenda, and I know Elvis is somewhere in the building, and you guys have lunch. So let me just tell you, I want to, on behalf of Phil and I, we want to thank you guys so much for coming out today. This was an amazing turnout. We love doing community events like this. You guys were engaged, so polite. I love your questions. Thank you so much. Come see me in the back. There's a table. You guys have a chance to win a 10-piece vegetable chopper that I bought for you guys. So if name, email, phone, you sign up there, you could win that. There's also, Phil and I also do a community health seminar series. So if you're local to Worcester, the Greendale YMCA allowed anybody to come. You don't have to be a member of the Y to come. This Sunday, the 15th at noon, we will be doing preventing cognitive decline and preserving brain health, which is another amazing health seminar. So if you guys want to come for that, there's information on the table about the seminar for that, as well as all of our contact information. We do free consults, guys. So if you want to talk with us, see if we're a good fit to help you, we do a free consult call, and then we give you some options to see how we could work with you one-on-one, or if you have a group or something like that, okay? I haven't picked yet. You can still sign up. You can still sign up if you haven't. I'm going to pick a random winner later, and I'll leave it at the senior center for you guys to collect your prize, okay?
And whoever's got the coins, if you want to bring them up front, we'll
Yes,
the most
yes,
coins wins.
all of you guys with coins, come return them to us, and our top winners here will give you guys some gift cards.
Thanks so much for coming, guys.